Okay, last time we talked about food and dog weight loss, treats, portions, all that stuff. But what if everything is going right and they're still like gaining weight? Like you got the diet dialed in, you're weighing treats like a mad scientist, and yet the scales are still going up. Well, that's when I start thinking less kitchen and more blood work. I'm Dr. Paul Ramos. I've been doing this for over 20 years, and today we're going to talk about something other than just food with dog weight loss. So let's get started. This is actually a big topic in my online place called Dogtopia, links below. So click the link if you want to hang out there. And that's where we talk about things like dog health, dog care, dog connection, and dog weight loss. The thing is with dog weight loss, about half of dogs are overweight in many countries in the world. But sometimes you have nothing to do with it. Like food and exercise is actually not the issue. The issue is actually medical. So we're going to talk today about the 3 most common medical reasons that I see why dogs aren't losing weight despite owners doing all they can in the kitchen. Reason 1 is hypothyroidism. In general, dogs get hypothyroidism, cats tend to get hyperthyroidism, but hypothyroidism means that the thyroid gland usually kind of around here, to the sides of the neck. It's a gland that produces a hormone called the thyroid hormone that's responsible for metabolism. And so when it's dialed down in hypothyroidism, the metabolism slows down. So you can have a dog on a perfectly good diet and you're doing everything right, and yet they're still a bit hefty. Other clues are they're kind of dull, they're lower energy, there's hair coat changes. It might be dull or thinning hair coat. It'll be kind of usually symmetrical as well. They will obviously put on weight. They'll be kind of round and rotund. They might have funny skin changes too, like we call them comedones or kind of like blackheads. It's usually in middle-aged to older dogs, and it's something that vets can check or test for with a simple blood test. So if you're doing everything right and you, let's say, take blood tests on your dog and everything's normal, this might be something that your vet might look into as well, if they're, not losing weight. Reason 2 is called Cushing's disease, or if you want to get fancy about it, hyperadrenocorticism. Now, this is usually a benign tumor, which is also a gland as well. That usually it's around sort of at the front pole of the kidney or in the pituitary or in the brain, producing too much cortisol or stress hormone. And it does this classic thing where we call this call it a tabletop appearance of the back. Like your dog is so round, it looks like a tabletop. And the belly is also very round. And part of that's because the muscle wastage has kind of, been accelerated. So they just kind of like go. And they also will have some skin changes as well. Thinning skin again, hair loss again. So sometimes Cushing's disease can look like hypothyroidism. And again, a blood test can rule that out. It's more of an involved blood test, but it's non-invasive. So it's something to think about if your dog is not losing weight as well. Other signs are they might be drinking more than normal and therefore peeing more than normal. Maybe they're panting. And so if you have like a pot-bellied looking dog who's drinking a bit with a thinning hair coat, it's probably something your vet will be a bit suspicious of, and they'll take a couple of blood tests. And both of those conditions as well are treatable. And reason 3, and I'll be honest with you here because sometimes it's us vets who kind of cause it, is in a way kind of causing, Cushing's syndrome by the medication. So by having excessive steroids, prednisone, by tablets that your dog might be having for skin issues, allergies, ear issues, sometimes autoimmune diseases. It's a good medication for when it's the right time to use it for sure, so never stop it. And always talk to your vet about thinking about changing any doses, but never do anything without the direction of your vet when it comes to medications. But sometimes the steroid medication can cause, again, panting, drinking more than normal, peeing more than normal, maybe eating more than normal, and they just pack on the weight. So those are the top 3 reasons why I might see dogs that are just gaining weight or not losing weight, and they're kind of okay otherwise, and maybe even blood tests are normal. Maybe there's hypothyroidism there, their glands producing too little hormone. There's Cushing's disease, their glands are producing too much hormone, and there is too much steroid medication, or not too much, but like the medications that they have for other medical conditions are just making it really just difficult to impossible to lose weight. If you know anybody on steroids, like, they can probably attest to that. So sometimes it's not really even about doing the right thing or willpower, yours or theirs. And if you want a hand figuring out how to get your dog to lose weight, like you've been trying for months or even years, and you really want to do it because either your vet says it's important, or because you know that they'll live probably a longer life if they do lose weight, or their weight's impacting them because it's harder to move or it's affecting their joints with arthritis, then tap on the link below in Doctopia and join us there. Thanks for watching, and see you in the next video.